Okay, Assalamualaikum and good evening to everyone. We are from group 1. We'll present the title Anemia. Before we present, let me introduce our group's member. Mine is Khairul Naimi Jamal, and then this is Nur Salma Jamaluddin, Nur Fatia Ahmed, and then Rozana Ahmad and Siti Yusniza binti Muhammad Yusuf. Okay, we will start now.
Anemia is a condition where there are reduced level of red blood cell or a reduced ability by the red blood cell to carry oxygen. And from Illustrated Dictionary of Midwifery 2012, lack of red blood cells, a low hemoglobin concentration or hematocrit on examination of the blood. The prevalence of anemia defined by low hemoglobin or hematocrit is commonly used to assess the severity of iron deficiency in a population. Age or divide to age or sex group. Children 6 months to 5 years, hemoglobin below 11, hematocrit below 33. Children 5 to 11 years, hemoglobin below 11.5 and hematocrit below 34. Children 12 to 13 years old, hemoglobin below 12 and hematocrit below 36. Non-pregnant woman, hemoglobin below 12, hematocrit below 30. Classification of anemia: first, iron deficiency anemia; second, megaloblastic anemia, which is vitamin deficiency anemia; third, anemia of chronic disease in HIV, AIDS, rheumatoid arthritis, Crohn's disease, and kidney disease; fourth, aplastic anemia, less production of red blood cell in bone marrow, which is autoimmune disease; fifth, sickle cell anemia, abnormal red blood cell, recent shape. Sixth is hemolytic anemia, red blood cell being destroyed faster than production of new one. And others is anemia, GSPD, hereditary spherocytosis.
Okay, we will continue. For my part, is pathophysiology. So when blood decrease in red blood cells as hemoglobin or hematocrit level, it will be diminished oxygen and because oxygen is carrying capacity, then will be hypoxia and hypoxia induce effects and on organ function. When effect on organ function, sign and symptom of anemia will present, such as such as sign and symptoms such as eye will be see yellowing, skin pale, coldness, yellowing. From respiratory, shortness of breath, muscular weakness, intestinal change to color, from central, fatigue, dizziness, fainting. From blood vessels, low blood pressure, heart palpitation, rapid heart rate, chest pain, angina, heart attack, and spleen enlargement. And second, nutritional inadequacy 50%, various gastrointestinal pathologies 50%, menorrhagia 9%, hemorrhoid 8%, hook wounds 8%, and hematuria 2%. These are from the table what I get. And for the high risk factors too, when you see this what we call chart diagram. Sorry. In diagram, for demographic factors, mostly is in elderly, teenager, female, immigrant, aborigine, and widower. From dietary factors, low iron, hem iron, low vitamin C, excess phytate, excess tea or coffee, fat diet. From social or physical factor, poverty, poor retention, candle burning, alcohol abuse, GIT disease, and depression. Okay. Okay. We'll see. We'll pass my partner.
Okay, my name is Salma. I will continue with investigation of anemia. Okay, before we get the investigation, we should have the history of patient. A patient must be previous or recent blood donation, previous history of anemic, adequate dietary intake, over blood loss, family history of iron deficiency anemia. The patient will have family history of hemoglobinopathies. Hemoglobinopathies is like kind of genetic defect that results in abnormal structure of one of the globin chains of the hemoglobin molecules. Non-steroidal anti-inflammatory drugs, NSAIDs or aspirin, used that have serogenic actions on the GI tract, and also for anticoagulant use which can provoke lesions, for example ulcer or lesions to bleed. Like patient who have often get the NSAID will get the ulcerogenic action on the GI tract, and patient will have anemia. For the physical examination, patient will have abdominal mass, cutaneous signs of hereditary hemorrhagic telangiectasia. Telangiectasia is a condition in which widened venules, tiny blood vessels, cause streak-like red lines or patterns on the skin. These patterns or telangiectasias form gradually and often in clusters. They are sometimes known as spider veins because of their fine and wet-like appearance. For blood investigation to define anemia, physician will have the full blood count that used to count the number of blood cells in a sample of the blood. Like normal adult for men, hematocrit range 40 to 52%, hemoglobin 50 to 80 grams per deciliter. For women, hematocrit must be in range of 35 to 47%, and hemoglobin 12 to 60 grams per deciliter. And we will continue with full blood picture, FBP, serum ferritin, TIBC, serum folate, and vitamin B12 is an option of blood investigation. Hemoglobin, BFMP, and stool over and cyst, that is optional blood investigation. Okay, next.
Assalamualaikum and very good evening. Okay, I continue our presentation. Medical management, iron deficiency anemia. Treatment for this form of anemia usually involve taking iron supplement and making change to your diet. If the underlying cause of iron deficiency is loss of blood or other than from menstruation, the source of the bleeding must be located and stopped. This will involve surgery. For vitamin deficiency anemia, treatment for folic acid and B12 deficiency involve dietary supplement and increases this nutrient in your diet. If your digestive system has trouble absorbing vitamin B12 from the food you eat, you may need vitamin B12 shot. At first, you may receive the shot every other day. Eventually, you need shot just once a month, which may continue for life depending on your situation. Or injection of synthetic erythropoietin, a hormone normally produced by your kidney, may help stimulate the blood cell production and ease fatigue. Aplastic anemia. Treatment for this anemia may include blood transfusion to boost level of red blood cell. You may need a bone marrow transplant if your bone marrow is diseased and can make healthy blood cell. Anemia associated with bone marrow disease. Treatment of these various diseases can include medication, chemotherapy, or bone marrow transplantation. Sickle cell anemia. Treatment may include the administration of oxygen, pain relieving drugs, and oral and intravenous fluid to reduce pain and prevent complication. Doctors also may recommend blood transfusion, folic acid, supplement, and antibiotic. A bone marrow transplant may be an effective treatment in some circumstances. A cancer drug called hydroxyurea also is used to treat sickle cell anemia. Medication, treating related infection, and taking drugs that suppress your immune system, which may be attacking your red blood cell. Depending on the severity of your anemia, a blood transfusion or plasmapheresis may be necessary. Plasmapheresis is a type of blood filtering procedure. In certain cases, removal of the spleen can be helpful. The last one, thalassemia, may be treated with blood transfusion, folic acid, supplement, medication, removal of the spleen, or a blood and bone marrow stem cell transplant.
Assalamualaikum and a very good evening. My name is Rosanna. I will continue with nursing diagnosis. Here we highlight two nursing diagnoses for anemia. First one is fatigue related to decreased hemoglobin and diminished oxygen carrying capacity of the blood. Our objective is fatigue is reduced with increasing of hemoglobin. The first nursing intervention is assess the specific cause of fatigue. Rationale. The specific cause of fatigue is due to tissue hypoxia from pneumocytic anemia. Second intervention is assess the client ability to perform activities of daily living and the demand of daily living. The rationale is fatigue can limit the client's ability to participate in self-care and perform his or her role responsibility in family and society. Next one is assist the client in planning and prioritizing activity of daily living. This will allow the client to maximize his or her time for accomplishing important activities. The next one is assist the client in developing a schedule for daily activity and rest. Energy reserve may be depleted unless the client respects the body's need for increased rest. The next one is monitor hemoglobin, hematocrit, RBC count, and reticulocyte count. Decreased RBC index are associated with decreased oxygen carrying capacity of the blood. It is critical to compare serial laboratory value to evaluate progression or deterioration in the client and to identify changes before they become potentially life-threatening. The next one is educate energy conservation technique. Client and caregiver may need to learn skill for delegating tasks to others, setting priorities and clustering care to use available energy to complete desired activity. The next one is instruct the client about medication that may stimulate RBC production in the bone marrow. Recombination human erythropoietin, a hematological growth factor, increase hemoglobin and decrease the need for RBC transfusion. The next one is provide supplement oxygen therapy as needed. As we know, when HB is dropped, the patient will become shortness of breath. The rationale is oxygen saturation should be kept at 90% or greater. The next one is anticipate the need for the transfusion of PEX RBC. PEX RBC increase oxygen carrying capacity of the blood. Refer the client to family to occupational therapists. The occupational therapist can teach the client about using assistive devices. The therapist also can help the client and family evaluate the need for additional energy conservation measure in their home setting. Our intervention is introduce yourself to the patient and the folks as the nurse assigned for the shift in order to foster trust which is needed in the working relationship. The second one is assess the capability of the patient to ingest nutrition or any other barriers such as being lactose intolerance or has a pancreatic disease. Knowing the factor that may affect digestion or ingestion can help in solving the root problem. Be aware of the medication, eating habits, food preference of the patient. The appetite and absorption of food is affected by drug interaction as well as food preference by the patient. For example, the ferrous fumarate should be taken in empty stomach. The next one is teach patient the facts about food. There are sources of folic acid. Giving an idea regarding the food sources of folic acid can enable the patient and folks reach the resources properly. The next one is encourage intake of folic acid supplement. Providing the information about supplement can widen knowledge of the patient regarding the possibility of the correcting his or her current state. The next one is discuss about the diet plan that is economical and easy to prepare to both patient and folks. Giving a verbal and written information about a diet plan can ensure continuous nutritional assistance. Economical preparation of menus can encourage the significant others to comply with the prescribed dietary regimen. The next one is assist the patient in the activity to consume of daily iron-rich food to help build up hemoglobin store. Ingestion of iron-rich food could help prevent anemia because it adds to the hemoglobin in the body. Iron supplement can also be taken to increase the hemoglobin level in the body. Enforce strict compliance in taking iron supplement as prescribed by physician. Follow-up, stress the need for regular medical and laboratory follow-up to evaluate disease progression and respond to therapies. This is our reference. I think that's all from us. Any question from the floor?
No.
Okay, thank you.